Turning to today's numbers, currently 77 people are in hospital in Alberta, including 13 in intensive care. We have identified 364 new cases of COVID-19, while our labs conducted more than 16,400 tests. 276 of those new cases are in Edmonton. As of today, AHS has confirmed that students and staff at 55 schools that previously had alerts are now back in class and off the list. There are active alerts or outbreaks in 170 schools, which is about 7% of all the schools in the province. Currently, these schools have 370 active cases in total. This number includes 72 schools that are on outbreak, including 14 currently on the watch list. Once again, I want to remind everyone that we are defining 2 cases as an outbreak, which is a very low threshold and reflective of a very cautious approach. It also takes 28 days or 4 weeks with no new cases before a school comes off of outbreak, so many of these schools have not had new cases recently. So far, in-school transmission has likely occurred in 27 schools. Of these, 21 have had only one new case as a result. Sadly, I must also report 2 new deaths in Alberta. These deaths were both in patients at the Foothills Medical Centre. They were announced yesterday by AHS. I want to express my heartfelt condolences to everyone who has lost a loved one to COVID or any other cause during these difficult months. There are currently 83 cases, including 42 patients linked to the Foothills Medical Centre outbreak. More than 2,300 tests have been conducted as Alberta Health Services is taking aggressive measures to identify any potential individuals who may have been exposed. There is also an outbreak now connected to 2 units at the Misericordia Community Hospital. In total, 10 cases are linked so far, and widespread testing is underway. My colleagues have informed me that outbreak protocols are being implemented at the hospital to ensure the ongoing protection of patients, staff, and visitors. Visitation to the affected units is restricted, but the hospital outside of those units remains safe for patients. Today, I would like to update you on COVID-19 in the Edmonton zone and announce new voluntary public health measures for the capital region. As I said on Monday, I am very concerned about the sharp rise in cases that we are seeing. As of today, there are more than 1,250 active cases in the zone. Over the past week, the positivity rate has increased to 4% in Edmonton. And the R value for Edmonton, which measures how many new cases on average are infected by each person who already has the virus, has risen from 1 to 1.3 in the past week. My team and AHS have been closely investigating the spread of the virus in the city. All parts of the Edmonton zone are being impacted by the rising spread of the virus, either directly or indirectly. While case ratios are highest in the northeast portions of the City of Edmonton, they are also high in southern Edmonton and other areas as well. As I mentioned on Friday, about 11% of active cases in Edmonton worked or attended social gatherings while symptomatic, which is concerning. Currently, about 36%, almost 2 out of 5 cases in Edmonton, were exposed by a close contact. Another 26% are linked to an outbreak. Where transmission is known, household or community contacts appear to be a key driver in spreading the virus throughout the city. Social gatherings and family gatherings continue to be a factor in virus-spreading events. We have also seen several workplace outbreaks where spread between employees has occurred, showcasing an opportunity to improve prevention measures within workplaces. The Edmonton zone now faces a crucial juncture. While the system is able to support the current caseload in hospitals and ICUs, the acute care impact is a lagging indicator. It typically takes 1 to 2 weeks before a rise in cases contributes to a rise in hospitalizations. We have been in close contact with officials in the City of Edmonton and other partners across the zone regarding this situation. We must take action to slow the virus's spread in the zone and make sure the health system can continue supporting Albertans with COVID-19, influenza, and many other needs. That is why, effective today, I am announcing 3 new voluntary public health measures in the Edmonton zone. These measures are voluntary because we still have sufficient hospital beds and capacity to meet the current needs at Edmonton. But we are moving forward with them because it is important to use our current data as a call to action. First, all family and private social gatherings should be limited to no more than 15 people. This is the maximum. The fewer people we come into contact with, the lower the risk of exposure or of us exposing others. This does not impact schools or more formal gatherings such as theatres, worship services, or other gatherings where an organizer is ensuring that all COVID guidance is in place. In these other settings, though, it is critical that all COVID guidance be followed carefully. For wedding receptions and funeral receptions, we recognize that these events in the near term have had a great deal of planning that has gone into them. It may not be possible to reduce these immediately to 15. However, if possible, we would encourage anyone planning these kinds of private social events or parties and family gatherings to reduce numbers as much as possible, aiming for no more than 15. Second, I am recommending that masks should be worn in all indoor work settings, except when alone in workspaces, such as cubicles or offices where you can be safely distanced from others or an appropriate barrier is in place. Finally, I am asking everyone in the Edmonton zone to limit their cohorts to no more than 3. Their core household cohort, their school cohort, and no more than one other social, sport, or other group. In some rare cases, individuals may belong to a work cohort as one of the 3, but this is not something that everyone would be a part of. Remember that a cohort is a group of people who don't have to follow all COVID restrictions at all times to enable an activity such as a team sport to take place. This is not the case in most workplaces. In almost all workplaces, measures should be in place to prevent close contact between co-workers, and therefore they would not be considered a cohort. Young children who attend childcare could be part of 4 cohorts, given that childcare cohorts have not been seen to be a high-risk context for spread, and young children are at lower risk of spreading the virus. These measures are not being taken lightly, but are necessary to prevent the spread of COVID-19 from continuing to escalate. Alberta Health Services will be continuing inspections of public serving businesses to ensure that existing guidance is being followed.